Okay, one of the most common things that we're seeing in the office a lot lately is knee issues, and we're seeing them where they're not. You can test it out. It's not an ACL issue. You haven't got any lateral collateral damage. I mean, none of that stuff. You're not dealing with meniscus issues. You're dealing with sore knees, and sore knees when you're exercising and when you're moving around. While you're working out, it feels good. 10 minutes later, the stuff hurts. What we're finding most of the time is that the quad muscle is developing much faster and much stronger than what the hamstring is. So you're going to get tension in through the knee, especially as the quad starts to turn into the big tendon that's surrounded. It's attached here. You can have tension down here. You can have all the tension through here. So we want to get in here after we've done our exam, work all this stuff out, make sure there's no restrictions in there, or if there is restrictions, we're clearing it out. We want to get in here and really work those quad muscles, loosen them up. This is one of those where I love the foam roller. I think it's effective. You want to work it here. The problem is when most people are getting some help with foam rollers, now they're wanting to do the entire leg complex. And what we're finding out is the quad muscle grows at a faster rate and grows stronger than what the hamstring is. So it's not so much that you're having knee pain. This is where it's screaming at you, but it's coming from up in here, and it's an imbalance issue. So what Brittany needs to do is get the quad muscle to relax a little bit using stretching, foam roller, any other techniques you want to do. Voodoo bands are really good in here. And then she wants to make the hamstring muscle stronger. So it's not, this is where it hurts, this is the only thing you do. And that's a problem that we're finding too much in healthcare right now. We need to look bigger and beyond and figure out what's going on. Release this area, get these muscles loosened up, make sure the hip mobility is working, and then make her hamstring stronger. How she's going to make her hamstring stronger is not by doing hamstring curls at the gym that's working the back side of the knee. She's going to get on the chair, and you're going to go lay on your back, and you're going to have your heels up on the chair. She's going to dig her heels in, get her legs at 90 degrees, grab the back side where those hamstrings and glutes come together. That's where the majority of the muscle is. And remember, we're not trying to so much worry about the injury here. We've got that feeling better. We want to fix the ratio. We want to make the quads and hamstrings the right ratio. Your hamstrings aren't weak, guys. Your brain has just forgot how to function with them and how to use them. So we're going to turn the brain and hamstring connection back on. It tends to take about 2 weeks. All you're going to do is use your hamstrings to raise your glute off the floor. Yep. And she'll tell you, you can do 2 or 3 of these and you're going to feel it. This stuff is a different way of doing it. Imagine doing bicep curls and you were doing it like this. You're shortening the muscle the reverse direction. It'll definitely get her attention. It gets her brain back on board, and all of a sudden, you're getting better knees out of this. We're seeing this over and over again with runners, CrossFitters, guys that are starting to do real high intensity stuff like getting up into bodybuilding. This is how you balance out that ratio and make those knees stop hurting.